Hi again, everybody. I'm Rob Rosenthal with AskTheLawyers.com, and this is another episode of Ask the Lawyer. If you've ever watched medical shows on TV, you've probably seen the doctors perform an airway procedure dozens of times, and it always seems to go well on TV. Unfortunately, in real life, what should be a routine procedure often doesn't go as planned, and that's what we're going to ask the lawyer about today. Here to answer our questions is attorney Michael Perez of the Warshauer Law Group in Atlanta, Georgia. Michael, thank you for making some time for us today. I appreciate it.
Thank you for having me.
So we're talking about airway procedures. I've heard the term intubation on TV. I've heard that all the time. Not exactly clear on what it is. Tell us what intubation is and extubation. Give us a little background on that.
Sure. Well, one thing we all understand and know is that to live, we all need to be able to breathe. And so airway management, intubation, those words mean essentially providing an airway for someone who is unable to breathe. And this happens in a couple of scenarios. Say you have someone who is going in for a surgical procedure, and they're going to be put under general anesthesia. We've all heard about that and seen situations like that with our loved ones or maybe even ourselves. Well, when you have that general anesthesia that's given to you, your body's being paralyzed so that you're not in pain. Well, as part of that, your lungs are not able to breathe,
Sure.
so you're not able to breathe for yourself. So in that situation, typically what happens is a patient is intubated. So a tube is put down their airway and oxygen is connected to it so that that person is still able to breathe and their body's able to receive oxygen. Another way it can happen is if you were in a car accident or you have some type of trauma, an unexpected situation where you lose your airway. Again, to keep you alive and to keep you breathing, doctors may have to introduce a tube or provide an airway for you. So that's generally intubation. And then extubation is the process of once you're able to breathe again because you've come out of the anesthesia or because the trauma that you have suffered has been fixed or repaired and you're able to breathe on your own, the tube is pulled out. And that is extubation.
Now, to a layman, those sound like really, oh my gosh, I would never want to have to do that. But is this a very complicated procedure? Is this something that most medical professionals should know how to do?
It's absolutely something that most medical professionals should know how to do and learn to do. In fact, the men and women who work on ambulances and are sometimes the first responders to a traumatic situation or a car wreck or something along those lines, a workplace accident, they are trained in airway management. Your ER physicians are trained, and really all physicians, as part of their medical training, learn to do this because it is such a critical skill. Again, we all have to be able to breathe. So if you are a physician and you are seeing a patient that for whatever reason is having a problem with their breathing, that physician, that healthcare professional needs to be able to provide an airway for that patient, to secure an airway for that patient so that whatever is causing the breathing problem or the distress can be ameliorated.
So what are some of the complications that you've seen? What are some of the things that can go wrong with this process?
Well, unfortunately, a lot can go wrong in these processes. And so, and it starts very early in the process. Any healthcare professional who is dealing with an airway issue needs to first do an assessment of the patient to determine what kind of difficulty there will be in providing an airway, and so it will guide them in what types of tools to use. So there's a standard assessment that whether you're an EMT or whether you're an emergency room physician, you're going to go through to make sure the person can be intubated. If they cannot be intubated, if a tube cannot be put down, what other way are you going to provide an airway for the person? So an assessment is one thing, and if the physician or the healthcare provider does not assess the patient correctly or adequately, then a wrong decision can be made and you could lose your airway. Another way that it can go wrong is that the intubation could be done incorrectly. We've seen cases in our practice where the tube that provides the airway, instead of being put down to your trachea, which goes to your lungs, it has been placed in the esophagus, which goes to your stomach. If a tube is put down your esophagus and air is provided through that tube, it's not going to go to your lungs. You're not going to be able to breathe, and so you're going to have problems there. Again, we've had cases where the tube may have been properly placed, but during the process it became misplaced. If somebody's having chest compressions done because it's an emergency situation, the tube can be misplaced. It's the provider's responsibility to be continually checking to make sure they have a good tube. There are devices that they can use to make sure that it's properly placed. And if those things are not done, if those devices and that equipment is not being used properly, it can cause a bad airway, it can cause a loss of an airway, and serious harm or death to the patient.
That was going to be my next question. Even a small error can have very serious consequences in those situations, correct?
Absolutely. This really is a life or death situation because once again, I hate to keep repeating myself, but we all need to be able to breathe. So even what can seem like a situation where everything is going well, the tube is properly placed, the patient has to continually be assessed. And if there's a change in that patient's condition, if all of a sudden they do not seem to be oxygenating properly, if all of a sudden they go into cardiac failure, that can be an indication that the airway has been lost. And again, the damages, even going just a few minutes without oxygen, could lead to catastrophic brain damage and death. So this is a situation where every second counts.
Is it difficult to prove whether it's medical malpractice or just something didn't go right, or is it often very easy to tell?
Well, all medical malpractice cases are difficult, and airway cases are no different. There are a lot of steps that go into, again, securing an airway, assessing it, properly managing the airway, and patients present in many different ways, and not all airways are as easy to get and to maintain. Someone who really understands airway management and airway mismanagement and who can see if those steps have been followed appropriately, if the proper equipment was used, and if the providers were adequately trained to do these airway management techniques.
So I would assume it's important to find a law firm, even if you have a suspicion, to get somebody that has a way to look at it, doesn't have any, can take the emotion out of the situation, and has the experience to be able to tell whether there was something that didn't go right, and also has experience with these types of cases before, and knows how to get information from the hospital and doctors and that sort of thing, correct?
Absolutely. It is critical if you or a loved one have been in a situation like we talked about where there's been a traumatic accident, EMS has come to the scene, or you've been in an emergency room setting, or you've undergone a surgical procedure and you have any kind of inclination that something went wrong, I would absolutely suggest that you go see an experienced attorney who knows these issues to get those records and to evaluate them, to see what happened, to look at the anesthesia records, to look at the medical provider records and determine what techniques were used, what equipment was used, what happened to the patient, and what indications there were that perhaps the airway was not properly acquired or was not properly maintained, and get that evaluated so that you can determine whether or not you were the victim of malpractice.
Because I would assume you shouldn't count on the hospital, doctors, nurses to just openly admit to having made an error.
Unfortunately, that doesn't happen. So it's important to get someone to look at that and to really develop the facts, right. Look at the whole situation, look at the story. The medical records don't tell you everything. So a lot of times you'll have to talk to other people who are around, who saw what happened. You will have to look at subsequent provider medical records, right, to really get a full understanding of the injury. But a skilled, experienced lawyer who knows these cases and know what the damages look like and know what to look for in the records can do that and help you put those pieces of the puzzle together.
Great. Michael, thank you so much for the information. It was very helpful today. I appreciate that.
Thank you so much.
And that's going to do it for this episode of Ask the Lawyer. My guest has been attorney Michael Perez of the Warshauer Law Group in Atlanta, Georgia. If you want the best information about medical malpractice, or you're ready to choose a lawyer that lawyers choose, please visit askthelawyer.com. Also, take a second to click on the button at the bottom of the screen and subscribe to our YouTube channel so you won't miss future episodes. Thanks for watching. I'm Rob Rosenthal with askthelawyer.com.